In no particular order, because this is the order you are on my screen. Diane, can you just say hello, please?
Hi, everybody. So my name's Diane Lane. I work as part of the South Place, which is part of the Integrated Care Partnership. So effectively a big partnership to bring together health and care and the voluntary sector and how we work better together to improve health and wellbeing locally.
Thank you. Frances, you're next on my list.
Yeah, hi everybody. I'm Frances Dewhurst. I am a social prescribing link worker, and that's what the SPLW stands for. And I work for Meridian PCN, which is the group of surgeries, Harston, Bourne, Orchard, Comberton and Little Eversden, and then 2 surgeries in Royston as well. But so it covers that sort of South Cambs patch. Yeah, that's me.
And Graham.
Hi, I'm Graham Lewis. I'm Partnership Development Manager for Healthwatch, Cambridgeshire and Peterborough.
Brilliant. Thank you, all 3 of you. The basis for today is very much a case of looking at what the implications for those people using and accessing health services are when it comes to digital. I don't need to tell everybody here that the last 2.5 years have seen a massive rise in digital services. I think various people have said that as a country we might have jumped forward 10 years in adoption of technology over the last 2 years because of the pandemic. So I think it's safe to say that digital is here to stay. I think it's safe to say that we will be continuing to meet like this as much as we are meeting in person, and that all of that has an impact on health services and how people are able to access those health services. So I've got a number of questions that I'm going to pose to sort of all of the presenters in a while, but for now, if I hand over to Diane to do your introduction and bit, is that okay?
Do you want me, Mark, to do all 3 questions or just the first one?
Let's just do the first one, which, if do you want to read it out, and then
yes,
I'll do you and then Frances and then Graham, and then we'll go through the other questions.
Okay, so our first question from Mark was, in our opinion, what's the impact of the increased digitalisation of health? What are the problems? And this might include specific examples. So, interestingly, so first of all, the person that ideally should have been here was our lead for health inequalities, or our digital lead, and neither of them could make it. So I'm trying to download their brains and try and give you a sense from the integrated care system about where we're at with some of this thinking. And I guess my immediate concern would have gone to digital health inequalities. However, last week I went to a conference, which was really interesting, and it was a very super techie conference with lots of demos and lots of exciting things. Now, I'm not naturally a particularly digital person, but I was really impressed with some of the usability around some of this technology. So I tried a health pod, for example. So in terms of positive impacts, I think we need to think about positive and negative. It required no digital skills whatsoever, but I stood on it. It took quite scarily my BMI, my blood pressure. I put my arm in it and took my blood pressure. And I know, and you also held on to it, and it gave you a body fat percentage, which was even more scary. But the bit that was interesting for me, and then it just printed it all out on a little receipt, and I thought, that's just brilliant. Why aren't all of those in our GP surgeries and community spaces? So I think there's something interesting, and then that talks to your medical records. So and you end up sort of getting all of that recorded, so a GP can follow up if you've got a particularly high blood pressure reading, for example. So I suppose there's something for me around this opportunity. So the positive side around what this can give people in terms of a broader and easier access to services potentially, and also how that can overcome some of the traditional barriers to traditional services. So whether that's around transport to get to somewhere, or whether that's around parking and the cost of parking, whether that's around the times of days of appointments and people doing shift work, whether that's about translating things into different languages, or, you know, people with childcare responsibilities or other kinds of caring responsibilities. So, you know, there is I think there's this role around digitization, and I think Mark's absolutely right. It's definitely here to stay. I think there's also something about the breadth of it. So I talked about the health pod, you know, idea. There's also some really simple things that people can do. So, you know, for example, getting your repeat prescriptions on the NHS app, for example, which is really useful for people. You know, apps that you can download. So I'm currently doing Slimming World, and I can go around a supermarket and scan in barcodes, and it can tell me how many cakes I can eat, which is not very much. This is back to the cake conversation earlier. And then I guess we've got then the other end of the spectrum around things like virtual wards. So this idea that, you know, people who, you know, might be in hospital and, you know, are on a improving trajectory and could be, you know, discharged slightly earlier, that they might be able to be given a whole load of kit to be able to, you know, manage, be remotely monitored, I suppose, in terms of their oxygen levels, or again blood pressure and various other things, and they can put that information into a system which enables consultants to be able to see that remotely. So I suppose there's all of these opportunities, but we know that obviously there are real challenges around that for some parts of the community. So we're going to be talking about that later, but I suppose the bits and pieces that I got from my colleagues in terms of some of the data was around things like thinking about things in terms of access to the internet, and the fact that, you know, 6% of the UK don't have access to the internet, and the fact that, you know, there are some rural areas that don't have good connectivity at all. Affordability of broadband or data contracts, and people, you know, again, you think about the challenges over the next few months and what decisions people are going to have to make in terms of being able to have that access, and even in terms of credit history and whether people can get a broadband contract. And then there's the access to devices, which I'm sure we'll all talk about a lot, so I don't want to steal anybody else's thunder. And also around skills, so having the skills and confidence to be able to go online, and also around motivations and people really seeing the benefits. But I think that fundamentally, I think there is something about where we're at the moment, about this big shift to digitalisation, that, you know, we are in a position where we need people to be able to have choice over how of the services that they receive and the way that they receive them. So I think that for me is the sort of overarching thing, that we offer people the opportunity, and we think about how people might be excluded and how we might be able to mitigate that. And later on in a question, I'll explain some of the things that we're doing on that.
Thank you, Diane. Frances, have you got anything you would want to add to that from your perspective?
Yeah, I mean, I think it's such a mixed bag at the moment. You know, I'm rather like Diane, speaking my own experience. You know, I now repeat prescriptions. I'm got my chart. You know, and most of my consultations are phone or video. You know, it's been great not having to go into admin bags. You know, and there are going to be quite a lot of people like me who are not like Diane. You know, I'm not. You know, I balk at some of the. I balk a little bit at the surveillance element, some of the stuff that's on, but you know, generally I'm gaining from it. But I with our patients, I'm very aware of those who are not gaining. So I'm very aware of those who it was one of the key questions we ask people when we talk to people. One of the first questions: are you linked? Are you IT? You know, how are you with your IT? It's absolute first question we ask, because it's going to make a huge difference to how we talk to people and what we can offer people. And when we talk about, you know, what's available to them. And of course, I started work in lockdown, and that was where it became critically obvious that the people who weren't linked to the internet were their isolation was worse than those who were linked to the internet for whatever, however they managed to do it. So I'm very aware that there is this very the divide that's there, and a divide that is not well understood, that there is you read, sort of my heart sinks every time I read something that says you'll be able to access this online, or the telephone call that says, did you know that if you check the website, it's very, very frustrating for people. So I'm very aware of those frustrations, and I could talk, more about I've sort of got, the sort of segmentation of the different people, because it's obviously people are excluded for very different reasons. So they can't all be put into one box. They have to be thought about in different ways. Which group are you talking about, and from not just which group, but which individuals you're talking about, and how they can be supported. So I see that. Daily, how we're managing around IT experience, really.
Cool, thank you very much, Francis. Graham, can I ask that same question of you, but at the same time, can you sort of go on to that second question about who do you think is being impacted the most as well, and whether or not you think digitalisation is impacting some people more than others? And I think Francis has touched on that, but I guess from a Healthwatch point of view, that's something that you are aware of. And you're on mute, mate.
Of course I am.
Thank you.
Do you want me to answer the first question and then introduce the second?
Yeah.
Rightio. Just checking. So the impact I've had during lockdown, I've had lots of appointments with doctors, and it's been great. I've been in and out of Addenbrooke's from the comfort of my sofa. I've not had to travel. I've not had to take so much time off work. So from my experience, it's great. I'd wanted video calls for donkey's years. It was almost like the health system was the one that going, oh no, that's not a good idea. We've got to have you in front of us. It's great. And I know that they've ordered things where I've had to go in for diagnostics and all things like that. It's great. So it makes life so much easier, so cheaper, so many things. But it's the challenges of people who don't have broadband, people who don't, all those things that have already been mentioned. But also some of this tech isn't designed through for accessibility. So GP websites, now when you phone a GP, it tells you to go online and fill in the form on their website. I work in our partnership boards with a gentleman who's blind, needed to speak to a doctor, couldn't get through on the phone because it was busy, but his iPhone will not allow him to fill in the form because he uses a voiceover technology to read to him. You have to deactivate the voiceover so that it can do things, but he still couldn't do the form. So no, he can't fill in the form on the website. And when he got to speak to a receptionist, it was, can you fill the form in on the website? It'd be much quicker. Why should he have to explain that they have not tech-proofed something to work with people who are blind, to work with people with access issues? What if they can't type? That's most people actually, isn't it? But just not useful for these things. So there are bits that aren't thought through, and people get left behind, because then that becomes somebody who doesn't have a doctor's appointment but would become really ill if they didn't get that. So and it's a lot of problems like that. And also a Zoom call or whatever it is the hospital use. If you're using a data package on your mobile phone, it will eat the whole of your data package just to do that Zoom call. Well, if I wanted to FaceTime my family, I would maybe prioritize speaking with granny or great aunt Doodah rather than a doctor over something that I think is slightly maybe not that important, but actually for them, actually for the sake of my health, would be much more important. So there are, things like that that aren't thought through which really need to be. And a lot of it is more about pure accessibility, because the second question was, who is being impacted the most? And the simple answer is the digitally excluded and anybody who falls under that category. So my immediate thoughts were older people. I've got aged parents. They're not on the internet. Yes. Getting them appointments and things is a nightmare. They're old people. People who are poor. Or just about managing, as the phrase was during an election. But people with communication needs, if you've got a learning disability, actually are the questions or things on a piece of kit actually that easy to follow? Does it really work for you? If you've got visual impairments, as I mentioned, some of the demographics, people from Black and minority ethnic communities, is it in a language? Does it immediately translate into a language that works for them, their language? When you're dealing with something that's emotive, you might have very good English as your second, third, or fourth language, but actually when you're dealing with something emotive and something really personal, your brain works in your first language. So, you know, would it actually translate well for them? Would they be able to do that when they're being quite emotive and things? So I think those are some of the key areas of who would be excluded. And so that, in a way, that could be people who are very tech-minded, very used to these things, but it's but not when they're emotive. Oh, and one of the problems, the wonderful My Chart. Of course, you get blood test results on that, which you then go and Google, because Dr. Google is all powerful and all knowledgeable, and can scare the bejeebers out of you, because it tells you things, but when the doctor sees all your results in a bigger picture, now that means nothing, but actually you're reading it as something completely scary and be borrowing more worry than maybe you need to. So these are all things about the surveillance thing that Francis mentioned is a little bit, can be a bit scary. So, yeah.
Brilliant, thank you. Yeah, and I think that last point is key. Yeah, my kids have had meningitis about 12 times already, according to Google, none of which have actually been meningitis at all, probably a heat rash, but there you go. So that second question to you, Diane, who do we think is being impacted the most, and is there a particular demographic that you think?
Yeah, I guess the biggest worry is that the people that are most likely to be socially, digitally excluded are the same groups of people that will be impacted by other health inequalities. So whether that's about Black, Asian and minority ethnic groups, whether that's about people living in deprived areas, whether that's people who are socially excluded for a variety of reasons. So that's why it's a particular concern and a particular why we need to mitigate those risks and think it through from the point of view of real people. I mean, I think the data that John Bartram, the lead for health inequalities, sent me was a whole load of stuff that I can send through to Sally later to kind of send round. But 67% of the people that are offline are 70 plus and more likely to be women. Again, talking about Black, Asian and minority ethnic groups, but particularly with older people are more likely to be digitally excluded. People who are disabled are more likely to be digitally excluded than if you don't have disability, and also obviously people living on a low income, and also it's about sort of income and education level. So I mean, you know, not that that's necessarily so there's a lot of people we need to think about in the mix, I think. I don't think there's just one group that's being affected. I think it's a range of groups of people that we need to really think through in terms of making sure people have the same access that everybody else does.
Thank you. And Francis, that same question to you, but do you also want to start elaborate on that last question?
Yeah. I mean, I'm talking very much from my patch, you know, and what we see here, which, I mean, it's a you know, it's not a deprived area overall, but I would say, in my mind, there are sort of three groups. There's those who've never engaged with IT, and they're generally the older, not necessarily, but sort of the older group who really are very unlikely to start. You know, they might do if you could get them to the library, to, you know, those things, but on the whole, and, you know, it's so difficult. I've got a woman who had had a blue badge for, you know, 10 years and suddenly had an application. They've got to renew it. It was all online. She couldn't do it. Some friend tried to do it for her and got it all wrong. You know, it was an absolute nightmare. A complete nightmare. She couldn't, you know, she didn't have a blue badge, she couldn't use her car. So, you know, that kind of thing. And she was incredibly distressed by it. It was very, very distressing experience for her. And there's a sort of tendency for that kindly person, when you get through to somebody on the end of the phone, say, can't you get somebody else to help you? And, you know, they don't want to ask somebody else for help. They're being sort of forced into a dependency which they haven't opted for. They were managing all right until everything went online. So it's a sort of enforced dependence, which is humiliating for people and also increases their isolation. Then I'd say there's a sort of another group who I think of as being perhaps challenged educationally, who perhaps have not had a high level of education. They probably do have a phone or a smartphone, but are really reluctant to engage with text. You know, they're not text people at all. So there's this sort of thing about, so much of this IT stuff is text-based, and for the people who are not text is not their thing, are really struggling with it. You know, they don't, whether or not they can actually download something from their phone, it's really hard for them to manage the text side of it. And those people are not necessarily particularly, they're not, the age isn't necessarily a factor there. It's to do with their, you know, who they are, you know, and age can be a factor, but not necessarily there. And then there's poverty, and then there's just the fact that you can't afford it, you know. So you've been, several people I know who've been reduced from, you know, they had a tablet or whatever it is, they can't afford to have two, or they've given their tablet away to somebody, you know, they can't afford to have a phone. And so the phone is the lifeline. They'll keep the phone as the absolute last thing, but the constant worry about how much it's charging them, and, you know, things like holding on to speak to the reception, you know, a lot of these things have got, you know, delays have now made that incredibly stressful for people. So, you know, they're not able to go online, they ring, they have to wait. So that's the poverty side of it, having to do everything on your phone, which really isn't the right device for things where you've got to do forms or lots of text, you know. And obviously we see people, it's not just health, I mean, we see people obviously you've got to, you know, engage with the DWP or whatever it is, you know, and that, so it's not just about health in that way for us. We get the whole range sort of problems. And in fact, you know, that the health side, from the level at which we're working in the GP surgeries, there are problems with this, not recognizing that people have a difficulty with it, but we can usually get around it. We will get around it ourselves by adapting what we do for that person, but we can't get around the other services that are so reliant on IT.
So, Francis, then, and I'm going to limit you to two. What are the two solutions?
Oh, yes. Well, I do think that there is going to be a group who is never going to engage with it. So for those people, we have to offer them a way to engage that isn't reliant on IT. So we have to be open and accept that they will not use it, and we must spend our time, you know, we must spend that extra time with those people. I think I definitely think with the group that don't don't engage with text, we need to think about how that information is conveyed to them in a way that isn't so text-based. So whatever it is we're doing, as Graham said, whatever we're designing has to be designed around accessibility. So it has to take into account the massively different people who we deal with. So I think that would be my absolute major thing, was, those who could get access need to have their needs met on that one.
Brilliant, thank you. Graham, what are your 2 solutions?
Well, yeah, acknowledge that some people will not. I think it should always be the first question, how do you want to receive information? How do you want your appointments? Face-to-face, letter, old school style? Or are you happy for a new system? That way, at least people from the off get the way things they want it. But actually, when you're designing a system, actually having people of lived experience involved. And if say you're designing a new, portal, web access system or whatever, to talk with people, actually not getting the tech people or people who use IT all the time involved, getting the people with disabilities. How will this work? A lot of GP websites have got an accessibility function, but the symbol for accessibility is an American symbol. It's not the wheelchair or the eye/ear thing that we're quite used to seeing. That means things for accessibility to us. It's an image of a stick person, basically, which doesn't make me go, that is about access. But so there are things out there which you need the voice of lived experience. At our championing access event back in July, we had CCS, Cambridgeshire Community Services, talking about what they're doing. And they've got a thing on their websites which will actually, if you click on it for certain times for access, it can do all manner of things, put things into easy read if you've got a learning disability, plain text, which is easier for a lot of reading, but also for voiceover systems and all things like that. But there were certain things that they just hadn't noticed, because they'd seen things which were a good idea, and then they're like, people going, oh, but what about this? And they're like, oh, yeah. So they're getting feedback. But to get that feedback really early on and people involved, co-production, not a nice little survey of would you like?
Brilliant. Thank you, Graham. And Diane, 2 from you as well, please.
Yeah, I'll do 2 in 1. So I think we've got to invest some time and some resources in it. And that's what we're doing in South Place. We're about to start work with Cambridge Online. So Sophia's here from Cambridge Online, which would be brilliant, and working with 3 primary care networks to effectively sort of test out how we can make this work for people that, the people that probably want to improve their health and well-being, but might not have access to a device or connectivity, or might not have the skills or confidence to be able to do that, and then sort of develop a very person-centered kind of package of support to help people to do that, and think about how we can do that collectively with the voluntary sector and with the wider public sector and libraries and maybe housing associations and others, to kind of think about how we kind of wrap around people to get people who want to be online to be able to access all the information and resources and support that's there. So I suppose that's what we're about to embark on. And I guess the other bit for me is then using that as an evidence base, essentially, about how we might be, figuring out lessons learned and how we might do that, in a sensible kind of way, but also providing a bit of an evidence base about what impact that could have on people and what we might need to invest going forward to sort of roll that out to the whole of Cambridgeshire and Peterborough. I think that would be brilliant. Yeah, and as part of that, one of the models that we're looking at with Cambridge Online is around digital health hubs. So that's my second bit that's part of the first bit. And they've done that in Leeds. And again, I'll send through some links for people to have a read. But where people are saying they can't get their blue badge, or they can't get, access to their NHS app, or they might need some support with, borrowing a device, for example, or getting support, financial support to be able to get connectivity, that you sort of wrap that all up in a sort of in a physical place. It could be in a library, or it could be in a community space, but that you actually have real life people that can help talk you through that and be able to get you access to the right places. But early days, but we'll try that out in a couple of places and see whether that how that goes down. But I think the co-production thing that Graham's talking about needs to be throughout the whole thing. So we need to be talking to people about their experiences throughout the whole process, and what's working for them, what's not working for them, and how do we get a model that could work in Cambridgeshire and Peterborough.
Brilliant. Thank you very much, all three of you, for that. That's kind of the introductory bit and my questions. And it's now kind of open to the rest of you. If you've got any questions or thoughts, then feel free to put your virtual hand up, and you can ask those particular questions to one or all of the panel members. So does anyone have a question or a thought that they would like to pose? Steve, your hand was up first, so.
Thank you, Mark. Thanks for those presentations, really, really good. I'm conscious of the fact that a lot of organisations have spent what feels to me like a long time trying to work out answers to the questions that Mark has posed and colleagues have answered. At one level, it feels like we're no further forward, but a couple of areas I just wanted to ask all the panel members about. One was around voice-enabled technology. So I know a couple of years ago, when I was more involved in this space than I am now, the next big thing was going to be voice-enabled technology. So I'm thinking of what Francis said around the text, and communication through the written word, which is what we kind of increasingly rely on. To what extent has anyone seen movements in the direction of voice-enabled technology, which in a sense cuts out one of the things that gets in the way of people kind of using services? And the other question is around, and it sparked by what Diane said about digital hubs, is that I know kind of historically people have set up services to give people confidence around digital stuff, and it's been badged as that. And I wonder whether that's been superseded by a need to get the services themselves showing some of the kind of qualities or elements that people have been talking about. So I just wonder to what extent people do use services that are badged as digital confidence building or skills workshops, or whatever, things like based in libraries. That clearly those things do get footfall and get used, but I just wonder whether the emphasis should be more around making sure design of services, picking up what Graham said around service user engagement and design, is the way to do things, rather than badging a service that is merely a means to getting something that really people want. Sorry, I haven't made that very clear at all, but hopefully you get my drift.
Panel, does someone want to answer Steve's questions?
I could do the second half.
Go on then.
I say answer. I mean, I feel like it probably could be opened up to the whole group, really, couldn't it? Yeah, no, I think it's a really good point, and that's why we would only maybe trial it in one place and do something different in another. I think there's something about it's all about people's time and capacity, I think, isn't it? To be able to spend the time to support people to feel confident and use the services. And I totally get what you're saying. I think there is definitely some interesting new roles coming out within primary care. For example, there's digital champions roles that NHS England are funding, or maybe the ICB are funding, and sort of digital transformation type roles within each primary care network, which is quite interesting. So these are all sorts of things to come that primary care networks can opt in and out of. So there is something around it there's a bit of extra capacity within primary care coming to be able to help, to be able to support people. But then you just think, oh, what's then, I don't know, yeah, you just got to think about where the skill sets are, and I think this is where we have to try and integrate those different elements in a sensible kind of way, I think.
Can I just jump in there with just thinking about what you said, Steve? That was kind of interesting. It kind of what comes first, really. You know, if you set up a hub, will people come, or do you have to sort of start from the other end, which is has somebody found a need for this? You know, rather than just an irritation with the system, but actually think I could do something about this. And there was an interesting example from Hertfordshire I heard about, which some people here might have been on the same conference, but they had the falls prevention were actually going to people's houses and giving them tablets with an exercise program on it, showing them how to use the tablet and leaving them with that tablet for 6 weeks or something to do the exercises. And they would, they said, press the button here, and they actually found people were fine with it. They actually really would, who'd never had a tablet, seriously the tablet for everything like that, were actually fine. And it worked for them to go for a home visit. It was still worth it for them to make that time to go and do it in somebody's house. And then once that person had actually, I don't know what happened. I don't know whether there were better digital results, in the sense that once a person had used the tablet, found it worked, would then be able to say, actually, I was fine with that tablet, my nephew said I could, and I'll be able to press that button and it'll go. But it's an interesting doing it the other way around, starting from the person's, the person's need, rather than setting up a hub and saying you can come. And I just thought that might be an interesting thought about how you could support people sort of over time and relatively gently into accepting that IT has become part of life, and they could then, they could then use the tablet to talk to their children or whatever it was,
Thank you, Graham.
I was going to say that I think Francis is completely right. It is that using something to achieve a different need, but actually this is just a little side issue that will be sorted in a different way. It took the pandemic for my mum to realise she could actually get cash out of an ATM.
Yeah,
she would never do it. So it's thinking about things that work for people, getting them to do what you want them to do without them realising you're dragging them kicking and screaming into the 21st century. But it's actually using what they need as a way of, well, if we use this piece of kit, it will do that. It will show you that. You can have the electronic readers for your blood sugar levels and things like that. It's little things that eventually it's something like people can do a lot more. So I think that is the key thing. And voice over technology, I've never used it. I don't really know much about it. I know I have friends who are dyslexic, so they speak into their phone for it to send texts and things like that. And if you've got the text thing going on here, it doesn't know how a lot of English words. And there are certain words, it just puts all manner of things up. Like if you say COVID, I think we've talked a lot about over the last 2 years, it'll put up all manner of different words like cover and come and all sorts, because it doesn't actually know what COVID is. And so, and if you're talking about health things, yeah, medications and things, these voice over technologies are not going to work for certain things, maybe, I don't know, or get confused by people.
Yeah, thank you, Graham. And I think that's it. Digital by stealth. Maybe that's the way forward. Sarah, you've got your hand up next.
Hello. Yeah, I apologise. I was just saying I got locked out of my house, so I was late. So I missed the beginning. Very silly. I've never done it before. But I just wanted to say, not so much about the new technology, but certainly about bespoke support in the home, because I'm currently working for New Horizons at CHS, which sadly is in its last month due to funding issues. Haven't been able to secure funding for a full project. It's been running since 2016, but for this last month, where we're talking about individuals who are economically inactive or unemployed, they can get 20 hours of coaching support, which is partially on digital access in their own homes with a coach. So if people weren't aware of that, if there are individuals out there, but for, it's interesting for where there needs to be adjustments to include people that have access difficulties. There might be a little bit of residual funding on the project. We do loan kit, and we have been looking to supply reconditioned equipment from elsewhere. But it might be that we're able to offer a little bit of support for adjustments to help access where there are particular difficulties. But sadly, we, at the moment where we stand now, we will not be taking clients after the beginning of November. So any funders out there, hello. Me and all the rest. Yeah.
Thanks, Sarah. And it's a shame to see that sort of thing going, that, you know, that there is arguably not an end point to the whole digital issue, because tech goes out of date and skills go out of date remarkably quickly. So I think that there needs to be a real understanding that actually what you are helping people do now might not be what we need to help them do in 2 or 3 or 4 years' time. And it might be that the tech interface has got easier, and we might have come to that ability to be able to talk to machines. But those of you who've ever asked Alexa to do anything, and or set a reminder and then try to work out exactly what it is that you've put on your shopping list, or what that reminder is trying to remind you about, will know that it's not always a perfect solution when it comes to talking to machines. So, Beth, you have your hand up.
Hello. Apologies, I'm going to leave my camera off because my internet is weak, let's say.
No, that's fine.
I'm just going to quickly outline what we do, because we're so if anyone doesn't know, Hay is collecting a load of activities.
Can you just say where you are from? Sorry.
Hay, it's How Are You, abbreviated, and that's a CPFT project looking at mental well-being activities in the community. So both from an activity side and support. So we work very closely with our Think Communities teams and social prescribers, and working on our relationships with the PCNs all across Cambridgeshire, Peterborough, Hunts. So in a way, we've got a slightly different angle on it, that most of what we're doing is trying to give information to people rather than needing that sort of exchange of information, filling out forms or so on. But we are very aware that as a digital project, there's limits to who we can reach or how we can reach them. And we've been acknowledging we're a digital project and acknowledging those limits, but we are also doing things like working with the libraries to make sure eventually people in situ there will know how to quickly access things on our websites for anyone who might be interested, who actually made it to the library. We're also looking at equipping the mobile libraries and the community bus with tablets, which can be taken to people not in their homes but in a more accessible place, and that whoever's staffing those will be able to enable people who don't perhaps have the equipment or the know-how to do it themselves. So it's a slightly different angle. It's not exactly answering what's been discussed, but we think that continuing those sort of social connections and almost using people asking for help to get them out of their houses and to get them seeing someone face to face, but sort of meeting them halfway with the technology, is perhaps solving some of the problems that we're encountering with people who can't access it under their own steam. So as I say, I recognise that slightly slightly widening what the scope of what we're talking about, but I think giving people equipment in their homes and leaving them to it, I absolutely see the advantages, and also that sort of trickle of giving them confidence in using the tech. But it is also removing an excuse or a motivation to get them out and see someone face to face, which is sort of a shame.
Brilliant.
That was largely a brain download, so thank you for listening to my ramble.
No, thank you. Thank you very much, Beth. Cheers. Thank you. Megan, you have your hand up next.
Yes, I think I want to do the same sort of thing as Beth, and I know Sarah and Beth and some of the work that they do. I was just going to come and inform you a bit from our point of view and the educational point of view of what we're doing under the local authority and the Department for Education, and how locally we're looking at how we prepare people in education for the world. And that comes under four pathways. So we recently got funding for a local preparing for adulthood lead. I know this doesn't come under, a lot of the people that are unable to access it. We've talked a lot about the older population and those sorts of things, but we're coming and doing the best that we can, sort of in the younger population, bringing them forwards. So the preparing for adulthood outcomes have four main pathways, and that isn't just employment. It includes health, community inclusions, and it includes what the world actually looks like once you finish education. And so even though I come under the role of a job coach, I look at what are their digital skills like, because how are you going to know where to find the jobs? Because yes, you can go into your local shops and find them, but actually as soon as you search on Indeed, you realise exactly how many jobs are actually out there. And so we are working on the younger population on how we can keep providing them the right sort of skills to be in the world of adulthood, and that includes the digital skills. And we do a lot of referring to people. We're trying to have this sort of hub of information where we can send people that have funding that can do things like support them with digital inclusion, to help them with things like health and all of those outcomes. So it was just from our standpoint, we're trying to help the sort of younger populations, and I'm happy to try and answer any questions if you do have, or signpost you if need be. But yeah, thank you.
Brilliant. Thank you, Megan. Thank you, Megan. Sophia, sorry. Over to you.
That's fine. So I just thought I'd introduce Cambridge Online, who we are. We're quite small, so odds are you may not have heard of us. But our sort of main or key idea is trying to give people access to improve their skills online. We also can provide people with devices if they needed. That's on a sort of certain criteria people fulfill, usually sort of low income and various other things. We run hubs in our own main centre in Cambridge, but we also have community hubs where people can bring their own devices to get help on how to use them. We come into our centre, use our computers, again, get some sort of one-to-one advice. We've recently sort of spoken to Hay and Joy. I attended a seminar recently with Joy about how that works. So to try and get sort of more social prescribers knowing who we are and sending people our way. I was sort of helping one client on a one-to-one basis, and that was through a social prescriber who got in contact with us. We've done a couple of sort of projects relating to healthcare in the NHS. I'm going to be starting quite a big one with Diane soon. So it is something that we know about, we are interested in. Our main thing is not having the funding or the volunteers or staff to be able to progress with it further. So we're sort of trying to grow and be able to do that and help more people as we can. So yeah, I just thought I'd introduce and say who we are, and feel free to email or get in contact by the website if you need any other advice. So thank you.
Thank you. Francis.
Yeah, I just wanted to pick up on a point that was made earlier on, which was about becoming, you know, your knowledge becoming obsolete, and I think that's something that we're talking about people who are digitally excluded, but digital exclusion, you know, can happen to you inadvertently, you know, because you fail to keep up with things. And I think that particularly about social media, because, you know, a number of our patients might have an email address, you know, so you can email them. So that's kind of technology that they're familiar with from work and that sort of thing. And then they might be using WhatsApp or something like that, you know, to communicate with friends and family. But then, you know, we certainly, I mean, I know in a way I'm saying about social prescribers, but as social prescribers, we have problems because, we don't have access to Facebook. We don't have a Facebook. We don't have access to Facebook. So we aren't able to go into a local village Facebook and find out exactly. We have to find somebody, a spy, to go in for us, basically, you know. So we're excluded. We haven't got a sort of social media. We haven't got a sort of social media program skills which we can use to access sort of the local, the very, very local services. And that, of course, will be the same for my patients as well. When you say something like, well, you know, your local group, you know, say, oh, you know, we get the magazine once a quarter or something like that. That is not the same thing as being linked in to what's going on in their area. And I know I'm talking about what doesn't sound like health, but it is health, you know. So that I think that thing about things move on, they move on very, very quickly, and that's something we have to keep on top of, and then we have to be able to keep on top of it for the other people who we work with as well.
Yeah, no, thanks, Francis. And I think that's it. And it has surprised me over the last 2.5 years how bad some of our larger statutory organisations have been when it has come to tech. I have noticed that a lot of smaller organisations have been able to move a lot more nimbly. But yeah, I have statutory colleagues who still can't use Zoom on their work tech because someone has decided that sometime in the past Zoom was not good for tech, and therefore they were going to stop all staff using it. So I think that is a massive issue, and I think that there is a big issue for us to think about how we communicate with different people and how we recognise that some people might have digital exclusion in one area, but they might be very savvy in another area. So they might very well know how to use Facebook, or you know, they might be a whiz at their I don't know, online gambling site, but they wouldn't be able to necessarily fill in a form. So digital disadvantage isn't simply not having any access to any tech. Anyway, Steve, what's...
Thank you, Mark. I was just wanted to ask people, presenters or others really, about the power of peers. So I know when I worked for Age UK, we did a lot of investment in local age UKs, and one of the most impactful ways of doing this kind of work, or a number of other kind of access to service issues, was around kind of locating the peers of people who could work, in a sense, promoting what it was we were trying to achieve, but would actually do it in a far more sort of persuasive and effective way than any big or little organisation could, coming from outside of those communities. So I just wonder whether there's any experience locally or any intent locally to use, and I appreciate this is, it's hard work, doesn't come easy, but is there any, are there any proposals kind of locally or thoughts about how peers in some of the communities we've talked about might be kind of positively engaged to promote a higher level of digital inclusion, resource issues aside?
Graham.
I think you're quite right. Peers have been used a lot in really good projects for different things, so that people who generally members of the community will come to and say, what about this? Where do I go for that? And then they can tell people all sorts. I think the big issue is people share certain information which is private, we're talking about health. You may not want anybody to know. Say you've got a cancer worry going on. Would you actually want other people to know? Because, things like that. And there are lots of examples of where people are a bit more wary. But I think it's really useful stuff. But yeah, because I know my sister-in-law has tried to show my parents how to use smartphone and failed. I don't think it was the quality of my sister-in-law's teaching at all. But it's that how to do things, and people who understand where they're coming from is really important. I think there's a good time for that type of stuff.
Yeah. Cheers, Graham. Megan.
It's just a quick question. I think it sort of raised some thoughts after Graham spoke there. Is there much work that's being done in the local area around accessing the internet safely? Because, there are lots of, I evidently have my own health issues, and I do have Facebook, but I know how to go onto Facebook and find a support group for such and such a health condition, but I know how to follow that support group but not necessarily like it, so other people don't know that I'm actually accessing it. And actually I've been trying to get my family's older generations to have access to the internet and how to do it safely and for their health benefit as well. But actually I don't think a lot of people know how to do that in a safe way, like you say, Graham, to not disclose too much information, but actually have the access to those support hubs, really.
Yeah, and I think, Megan, that is a massive issue. Francis.
Yeah, I was just going to say, I think what we see is a lot of people who one of the reasons why they don't want to go use the whatever they say. I've had people say to me, I don't use IT, and then they say, oh, I've got a tablet, so they don't necessarily know what they mean, but they're very nervous because of the scams that they hear about, and I have had a patient who was being, I have had that situation. So, but you've got the contrast between them absolutely terrified of using, social media, but at the same time they'll pick up the phone and they'll give their bank details to the first person who calls. It's a different view of where the risk is going to lie, and getting over that barrier to say, you can use it safely if you know what you're doing is one of the big reasons why I think people don't use it, because they don't understand the difference between social media and and just looking at something on the internet. I don't think they understand that there's a difference between the two.
Yeah, no, I think that is very true. That is very true. Sarah.
Yeah, I just thought that was interesting, because what I was actually employed to do, and my role's diversified since then, was to set up light touch support for New Horizons clients post their 20 hours of bespoke one-to-one coaching. And one of the ways that we decided to go about it was to set up a Facebook page. Now that meant that I could flag up any scams that were happening at the time, or training opportunities from the various organisations that you represent, or support opportunities, as well as update them on whatever the government is deciding to do to support cost of living. But I have found that not many of our clients, even though they potentially had the skills and ability, working to join a Facebook group. So I haven't had much uptake. And interestingly, I also found that some of our coaches were very reticent as well. So it's not really worked, which is a shame, because I can actually flag up very specific things that are potentially useful to people, and all they have to do is look. They don't have to engage at all. So it's interesting that there just does seem to be this general reticence, because I don't know about anyone else, but if you're looking at Martin Lewis's page, it's dense with information, and it's very hard to find what you actually want or what's specifically useful if you're on a low income and you're looking at what support there is. So I can just filter it a bit and make it a little bit more user friendly, but no audience, I'm afraid. Very few. So that's just an observation.
I think that's it, and I think we need to work out how people are using digital and technology as much as we do, trying to convince them to use what we think is the best route forward. And I'm not sure what the answer to that is, but I am very sure that what someone said earlier about not assuming that what is right for one person will be right for everyone else. So having those different those different groups of individuals that you might contact in different ways or work with in different ways is the only way forward, because we can't assume that everyone will use WhatsApp or everyone does like LinkedIn or everyone does like Facebook or everyone will read their emails and stuff. So, I think that's something that organisations are going to have to grapple with. I think the other key things as well, that as far as health is concerned, it's almost too late to start someone on a digital journey when they're trying to do something like access a doctor's appointment or access a consultation with a consultant remotely. You have to have started that journey earlier. There's that whole issue of taking baby steps, and people like to be able to do that learning without having to jump straight into that very difficult potential video call with a consultant. And if that person has spent some time getting used to talking online with friends or family, and actually they are more likely to be able to take that leap should it come to a health thing. So I think for me there is that growing realization that those within the health system actually have a role to help everybody become digitally engaged if they are going to continue to look at providing a significant part of their services remotely. So, I mean, I guess that's me winding it up. I think the other thing certainly from our point of view, working with voluntary and community organisations, is that we talk a lot about digital capabilities of individuals. I think there's also a need to talk about the digital capabilities of organisations as well sometimes. And I think that is really important, because as organisations, we have to get our heads around all of this so that we can do what it is that we do better. And that was my plug for what Sally has just put into the chat. For tomorrow, we'll be looking at some of the ideas around digital skills in the workplace, and we've got some really good speakers, some really good national speakers coming along to give their thoughts and views on that. So if you haven't already booked, the bookings are still open, and we would love to see you there. Any final comments from anyone from our panel members or for anyone here who want to do that final plug for the work that you're doing? No.
I was just going to add actually something quickly. I mean, I think there's underused potential in our systems, because we can actually record whether people are IT, competent or not. And I think that's a resource we haven't really used for trying to pinpoint people who might benefit from support. So I'm not offering that in any sense that I've been authorized to do so, but I think there's something, there's something there that we could use, because we have patient records and we can sector people, by that way. And so that's just a thought I thought might, if we were going to do something to, have an initiative to try to approach people who weren't IT savvy.
Francis, in that case, just absolutely send us that list, and we'll give them all a call and see. But I think you're right. I think that's it. I think we do need to think about how we approach people and what we are offering them. And I think Graham's point about getting some of the people who are actually going to be using these systems to think about them right at the beginning has got to be the way forward, because it's hard enough to fathom your way through some digital services, even when you're supposedly digitally competent, and yet others are so easy to use. So we need to learn from those. It's very easy now to buy your TV license online. Why should things be difficult? Why shouldn't it be as easy to get your health service as it is to get your TV license? Anyway, can I just say thank you very much to Francis, Graham and Diane for being our presenters and for answering those questions. Thank you all very much for coming. Do book on the rest of the event. And I'm going to